Hi, and welcome to LiverDojo.com. LiverDojo.com is an online platform based on YouTube and various different social media channels to tackle health inequality in liver disease across the world. I'm Dr. Nadir Abbas. I'm a liver doctor working in Birmingham, United Kingdom, and I'm very grateful to Guts UK and Dr. Falk for providing funding towards this project and BSG for endorsing it. So why did we want to do this? Well, first of all, looking at the health statistics from United Kingdom, we know that health literacy widens health inequality, where more than 4 in 10 adults struggle to understand health content written for public. In addition, the UK has 7.1 million adults that read at or below the level of an average 9-year-old. This low health literacy is then linked to poor general health, increased hospital admissions, low vaccination uptakes, and various other causes that reduce life expectancy. In addition, we have groups that are higher risk, those with language barriers, people with learning difficulties, and people living with dementia. Two of the main causes of liver disease currently in the UK include alcohol-related liver disease and metabolic liver disease, or traditionally called fatty liver disease, that was a result of excessive fat and being obese. We now know that both conditions can work synergistically and cause your liver disease to get worse more quickly. This is statistics from England 2020 and 2021, and as you can see, presence of excessive weight, obesity, and fatty liver disease is highest in people with most deprivation, disability, and ethnic minorities. It is also found in people who are less educated and have no qualification. In addition, we know that apart from white British men, alcohol is a major problem in the Punjabi community across the UK. Wolverhampton, which is a small council in Birmingham, has the highest levels of alcohol-related deaths in the UK. This is again data from NHS Digital 2020 and 2021, whereby we see that on the map, overweight and obesity rates in red are above 12.5% in that particular area. Certain areas of Birmingham, such as Wolverhampton, Telford, have the highest and the worst alcohol-specific mortality in the UK, with more than 25% of this being males. And whilst there is very little qualitative research with regards to ethnic minorities and alcohol misuse, the Shanti Project supported people in the Punjabi Sikh community of Birmingham with alcohol misuse, and they also support individuals who drink as well as family members who are affected by another person's drinking. And this is a snippet of the questionnaire that was given out to individuals, and if you can see in table 7, the top 2 priorities, the top 2 types of support services needed locally were education and awareness of children and young people around alcohol misuse. So how does this affect liver disease? We know that liver disease generally is on a rise worldwide. In England, the death rates from liver disease are 4 times higher than what they were in 1970. Other major diseases such as heart disease and lung conditions have seen a serious fall in the same period, and COVID-19 pandemic has made things worse. There's a 21% increase in deaths from liver disease in 2021 compared to 2019. To put things into perspective, around 1 in 5 people in the UK drink over the recommended limits of 14 units, and around 2/3 of UK adults are overweight or obese. The rise in obesity level among primary school children is highest annual increase since records began in 2007 at 4.5%. Majority of these deaths due to liver disease are preventable. So in the words of Walt Disney, the way to get started is to quit talking and begin doing. So what did we do? From a survey done at one of the largest liver units in Europe, in Birmingham, we found that patients with low English proficiency and those with low health literacy and patients with Black, Asian, and ethnic minorities had poor health outcomes and poor understanding of their liver disease. We also found that information leaflets are a redundant way of information. Often patients do not read it. And now, in the world of digital marketing and digital age, we now can reach out to much wider population and engage in a better way by providing them with a video platform. These days, everyone has a smartphone. And at the moment, as far as we know, no such platform exists whereby qualified health professionals are able to provide reliable information to patients with liver disease and their families. In addition, if we are able to replace information leaflets or at least cut down the costs and the amount printed, this would be an environmental friendly step. We wanted to base our platform on YouTube, which has one of the highest viewership at 2.56 billion people around the world, and we wanted to host these videos on various different popular social media channels as well. More importantly, we wanted this information to be reliable and from professional sources. At LiverDojo.com, we have assembled a team of qualified medical and health professionals, doctors, nurses, and allied health individuals from across the world. These are qualified liver doctors, nurses, and allied health professionals that will educate and empower both potential and diagnosed liver patients and their families, which will help you to make your informed decision, health choices, and in the long term, this will reduce the cost burden on various different health systems, including the NHS. So how will we help our patients or the traffic coming to LiverDojo.com? We aim to use simple, balanced language. We aim to use your language that you can understand. We will also include captions, and we'll find the focus and online information that is pertinent to your condition, and also use various different social media platforms to reach out to younger individuals who are not being targeted by government policies at the moment. How this project will work is we are currently working on script writing and filming, and have also approached professional media houses to help us record highly professional videos with great quality video and audio content. We aim to record videos in all major languages spoken in the UK with focus on liver cirrhosis, alcohol-related liver disease, metabolic-associated liver disease, and also around procedures that are commonly carried out in the liver world, such as liver biopsies or other procedures. We will aim to present our findings in one of the national or international meetings, and will also apply for further funding to expand into stage 2, which will involve other collaborators, health partners, and required funding for marketing and approaching community centers to further disseminate the information from LiverDojo.com. We do aim to go global, and we will be open to any form of partnership that will help drive policy change. So thank you very much. I hope you can subscribe, hit the like button, and press the bell icon. Tell your friends, colleagues, and patients. Please comment and critique us, and I'll be very grateful if you are a liver physician to join LiverDojo.com. And if you're a patient, please tell your families. Please tell other patients about LiverDojo.com. And at the end, I'd like to thank British Liver Trust for providing a lot of this information. Their website is really helpful, and I'd advise everyone to visit their website for information, and also NHS Digital for providing some of the information that I've used in my presentation. I hope